And welcome to the program. We appreciate you joining us. Well, I sat down with Craig Wilson. He's the newly installed president and CEO of the Arkansas Center for Health Improvement. He served in that role in the interim. He's been there for over a decade. We caught up on where Arkansas is headed with its rural healthcare transformation opportunities. Joining me now, Craig Wilson. He is the president and CEO of the Arkansas Center for Health Improvement, ACHI. Good to see you.
Good to see you.
Congratulations.
Well, thank you very much.
On removing interim from your title there. So, for people who are not deeply versed in what ACHI does, explain what the Arkansas Center for Health Improvement does.
At our core, we're a health policy and analytics shop. We've been around for more than 25 years now. I've been with the organization for more than half of its life, so I'm very familiar with how the organization operates, and we translate data into information for policymakers to make good decisions.
Yep, and you guys are at the center of a lot of healthcare debates at the state capitol and in public affairs there.
Yep.
What might you do different with the organization? How are you going to lead this organization differently than your predecessor?
Well, you know, we're going to have a little bit of a different style. I have, of course, a different style, and I come from a legal background, so that's a little bit of a difference. But, you know, I think really the dynamics of the organization, you know, are not owned by the leader, I don't think. We kind of respond nimbly to what's in the environment, and really, you know, in the healthcare environment, about every 3 or 4 years, everything changes.
Something major,
there's something disruptive. And so, you know, we'll do our best to be responsive to what's in the environment. I think one of the things, though, that I really want to do is establish some research collaboratives, cross-disciplinary, you know, in the education space a little bit. We're gonna move a little bit into doing some something that, you know, we can uniquely do in the healthcare space. You know, one of the things that I think has been missing is a focus on supplemental coverage, like dental coverage and vision coverage. We forget that those two things are part of the body as well.
Yeah.
And I think we're uniquely positioned to be able to make some advancements in that space from a research and analytics standpoint.
You mentioned that healthcare changes every 3 to 4 years with something pretty dramatic, and we're in the midst of that right now, as a matter of fact. Let's talk about 2 different issues, starting first with this insurance premium subsidies through the Affordable Care Act exchanges. It does not look like at this point that a deal is going to get struck. Right. What happens when a deal does not get struck?
Yeah, you know, I always use the example of an individual who's just above the income level for coverage through Medicaid. And that's roughly about $25,000 annually for an individual. So for that individual, their coverage might cost them in the $13 to $15 range now. Without the enhanced tax credits, that's going to look like a huge leap. Closer to $100 for them on a monthly basis. And for folks living at that income level, those are hard decisions about whether to continue that coverage.
So the possibility exists they don't get coverage, they drop out of the pool of insurance, that causes everybody else's premiums to increase.
And those are, you know, the people who are going to forego coverage are going to be your healthier individuals because they, you know, there's not enough risk for them there to purchase coverage. And so you're left.
If they do have risk, they're going to walk into an emergency room, which is going to jack up prices too.
And so the pool that's left are the older, sicker populations, and that results in what's called a death spiral, and it just continually gets older and sicker.
Yeah. Well, we'll watch that debate. We'll see, and if you guys put anything out on that, be sure to send it my way. The other thing that I think is pretty major here in Arkansas, and there's some components to this, is this rural healthcare transformation grant money. This is part of the One Big Beautiful Bill. There's, I think, $50 billion over about a 2-year period that's going to get dispersed to the states. Arkansas anticipates it could get as much as $500 million to $1 billion through all of this. What do you think is realistic in terms of expectations on this?
You know, it will not ultimately cover some of the reductions in funding that we've seen through the budget bill federally. I think what the budget bill really represents is a huge financial shift in responsibility from the federal government to the states and localities. So realistically, you're going to see a lot of variability in how states approach these funds and whether they're willing and able to complement those funds with state and local funds. You know, the Rural Health Association, of which I'm a founding board member as well, and the Arkansas Center for Health Improvement has endorsed as well some principles that the Rural Health Association here in Arkansas put out. And I think it's really important that our rural providers are working collaboratively and regionally. So I think that's going to be important. And the way that we go about divvying up these funds, that we do it in a very transparent and strategic fashion.
Yeah. Some of this money, I think, from just some of the policymakers I've talked to in the governor's office, they want to see this, and other stakeholders want to see some money put into workforce, not just your healthcare workforce, but also your doctor workforce with medical residency slots. And telehealth, two big areas there. Talk a little bit about both of those areas and what the needs are that you see.
Yeah, you know, we've done a lot of workforce analysis, primarily in the physician space, and we still need, we're still lacking in supply. There's a lot of maldistribution in the state. If you look at it on a statewide basis, it looks pretty good. But if you look in certain pockets, the supply is just not there, in both primary care and specialty care. One of the things that I think we really need to think about is establishing really a standardized and modernized way of collecting healthcare professional licensure information so that we can really, you know, on the front end establish a baseline of where we are now. And what we can do after the 5 years of these funds are dispersed.
Yeah, interesting. Last question for you. What do you think we're not focusing on in terms of healthcare that, and maybe it was in this application, but it has not garnered as much in terms of the headlines?
Yeah, you know, I think with any funding disbursement of this magnitude, you're going to have a lot of entities out of the state who are going to try to come into the state and may have good intentions but may have bad intentions. We've seen some of our rural hospitals that have been subject to some private equity investment that has turned out not so good. So making sure that the vendors and the investors who are coming in to do some of the projects that are going to be funded are vetted and really have good intentions for the people of the state of Arkansas is going to be important.
That's Craig Wilson. He's the CEO and president of the Arkansas Center for Health Improvement. You can catch our full interview online at talkbusiness.net. We're back with John Brummett of the Arkansas Democrat-Gazette right after this.